blocks out all the external distractions that bombard our souls.
Can you pee in it?
I'll take 2 hours.
Kite catastrophes, attempted murder, and don't leave a guy hanging. Get ready to laugh.
Are you ready to laugh?
Because today we are breaking down and reacting to all of the hilarious medical scenes and absurd injuries from The Simpsons. Let's dive right in. What happened to his friend? Looks like a dandelion. Angioedema is the word that we use when there's swelling around the face. Very bad, dangerous scenario. This individual needs an EpiPen ASAP.
Nowhere to tie my kite. And I forgot my scarf. Bingo!
Oh, wow. No, absolutely not. Not cool at all.
It's not cool.
The obvious, of course, is strangulation issues. Decreases blood flow in and out of your brain. Will then lead to passing out and then increase the risk of stroke. The other component is that string is really fine, so it actually can cut the skin pretty easily.
Oh my god, a box kite!
It could potentially happen depending on the material that's around your neck. Would it have a perfectly clean cut like this? Probably not. It'd be probably more jagged and ripping in different directions.
I'm alive!
Ah,
oh, that's it.
nice.
End of story. Actually, there's a little more.
What? Oh
I'm
my
sorry.
gosh.
This is the only way to lengthen Bart's life for a year while shortening yours by 30.
They fixated his head to Lisa's body, intertwining all the appropriate connectivity. There's no necrosis to his head. Like, come on.
Come on! Oops. All good.
You can see his spinal column there. How high is it will determine if you would be instantly dead or not. The lower you go, the less likely that you're going to have immediate death.
Lisa, I'm
Whoa.
afraid your tummy ache may be caused by stress.
We were all taught in medical school to listen to all 4 quadrants of your abdomen just because there are different organs in different areas. But in general, when we put our stethoscope on your abdomen, we're really just listening for bowel sounds. You're listening for hyper or hypoactive bowel sounds. We just heard hyperactive. A lot of sounds, a lot of things going on. So things are moving a lot.
I could prescribe some harsh antacids, but I think Lisa would benefit more from some herbal teas or aromatherapy.
Yeah, you know, some of that all-natural stuff is really very well...
Oh, no, you don't. Screw that touchy, query crap.
Oh my gosh. So I do think sometimes herbal teas, aromatherapy, massage are all good modalities to attempt. Sometimes people will go a little too far down the rabbit hole of only doing that or only doing medications prescribed by doctors. I think there's a role for a lot of these things and maybe not so extreme one way or the other.
All right, that's it. Shoo, you stupid crows. Shoo, shoo, shoo.
I don't think crows are stupid. I think they're actually pretty smart. Yeah. Ow.
That is not a worm.
It's not a worm. What are they grabbing?
Ow, ow. I hate getting stitches in my eyes.
So super interesting. Me as an emergency doctor, we sew people up all the time. But when it comes to the eyes, we don't really mess with them. Simple lacerations, eyebrow or underneath the eye, no problem. But when it comes to like eyelid, the tarsal plates, the eyes themselves, nope, I need an ophthalmologist. I need an eye surgeon.
Stupid crows.
Don't be mad at the crows, Homer. They weren't trying to blind you. They were just trying to drink your sweet, sweet eye juices.
The issue ends up being if there's a laceration through the globe of the eye, you're dealing with the fluid coming out of the eye, the vitreous and the aqueous. You don't want to be messing with that.
Homer, for your eyes, the best tonic is chronic. Medical use of marijuana is legal in this state. We'll also provide you with a prescription bong.
Talking about the eyes, that's from glaucoma, showing that medical marijuana or cannabis can reduce intraocular pressures, not necessarily injuries to the eyes themselves.
Okay, let's see. Toke as needed. Caution, objects may appear more edible than they actually are.
Sometimes with patients that have cancer and they're going through chemotherapy, their appetite is very much suppressed. So cannabis has been used as a stimulant because it can give you what they call the munchies or desire to eat. Please be careful with this stuff. They actually do show studies that using cannabis at an age where your brain is not developed can actually cause long-term problems. Whoa, there's a lot of hooks.
Stay here.
Hooks with blood on them. A lot of blood.
Hey, meat hooks. Hook meat much?
Ow! Hooking the roof of your mouth. Think about that. You have a hard palate there. You have the soft palate. The hard palate, it's hard because it's bone. And then the soft palate, more soft tissue back there. Your mouth does bleed a lot. It also mixed with saliva.
Wilson, where are you?
Oh, he's hanging. Yeah. Would this kill you? No, not necessarily. You actually could take a while. It could be very painful and airway issue as well as the GI disturbances. You're going to be leaking blood out slowly and then increased risk of infection, which usually takes a couple days.
Well, I suppose Bart could be immune. Genetic chosen one, if you will.
Oh my gosh. Look like zombies. Bags under the eyes, a redness. Sometimes if that's the whites of the eyes, you call that scleral injection or conjunctivitis. You see them drooling. Sometimes when people are drooling, they have issues relating to the salivary glands, or maybe they have rabies. Rabies, you have a fear of water.
Rabies causes fear of water.
A lot of times you actually are foaming at the mouth, and usually has to do with dehydration and saliva.
You must get him immediately to the safe zone just outside of town. If you see my wife, tell her I love her.
You mean tell her I love her, or I meaning you?
Oh no.
I'll just high-five her.
Human bites, we actually deal with this in the emergency department. The human mouth is quite dirty. These are puncture wounds. Puncture wounds are really hard to clean because the bacteria get embedded into the tissue. So even when you try to clean these out, you may or may not get everything out. So a lot of times these are at high risk for getting infected.
Oh, no freezing.
No, Mr. Simpson. This is a sensory deprivation tank.
Oh my goodness. Let me know in the comments. Has anybody done a sensory deprivation tub? I've done it once. Really cool.
Very cool stuff.
My wife, Jen, she did it. She hated it.
It blocks out all the external distractions that bombard our souls.
Can you pee in it?
I'll take 2 hours.
If float tanks aren't your thing, Chillax by my company Life Happens might be. It's a doctor-formulated occasional stress supplement to help ease the tension and bring on those calm vibes. Check it out at lifehappens.com or on Amazon.
Is this what passes for eternal rest these days? Ron, go get Daddy his burying shovel.
Okay, I'm ready to get out now.
Oh my gosh. Buried alive. You're going to start rebreathing a lot of CO2, which will cause you to get lightheaded, dizzy, euphoric. You'll ultimately end up passing out. And then over time, you're going to slowly stop breathing because you're going to be so hypercarbic that you're not going to have the drive to breathe anymore. And then you're going to pass away. These are great clips to talk about from a medical standpoint. I can't believe we're on episode number 26 and we're still getting medical clips from The Simpsons. This is great. I hope you guys learned something. I know that there was a lot of good medical information in this video today. So please definitely check out this playlist right here. Binge watch everything. And as always, please subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.